Okay, Assalamu alaikum, dear students. You are welcome. Our lecture today is about the stress, new topic stress. I think the term is very famous, very clear, and all of you hear the term stress. We are stressed. Everybody is now stressed and living under stress. So we'll try to discuss the stress in more details in scientific way. Let us start with our objectives today in this lecture. First lecture about the stress. This lecture will enable us to describe the model of stress. How many theories they are discussing the stress, particularly the transactional model. And the second, impact of the stress upon the health. So what's the impact of the stress on the health? Why we are saying always stress is not good for the health? Too much stress, prolonged stress, severe stress. So first, theories of the stress. How the stress explain the impact of the stress on the health, from which aspect the stress is not good and why. And lastly, stress for the health professionals or the healthcare professionals, including the doctors or even the students, medical students. We will study the stress on the healthcare professionals. So three aspects today. Let us start with the first part, which is the model of the stress. What is stress? So we will start with the stress and the theories about the stress. What is stress? Simply is the way we respond to circumstances. So how we respond to circumstances, to the environment, to the situation, these circumstances that threaten us, and something in front of us, and tax our coping abilities, So how you are respond to the circumstances? Very simply, how you respond to anything in front of you, any event. Of course, that event takes our coping abilities, takes our energies. So another definition, it is a mental and physical condition. So mentally, how we respond, whenever you hear mentally, mean your thinking, your emotion, and your behavior, and physical, some changes in the body, occur where person must adjust or adapt to the environment. So look to another point. So there is environment, something in the environment, you should adapt, you should adjust to that thing, that event, mentally and physically. Mentally, by your thinking, emotion, and behavior, and physically, some physiological changes will occur in the body. So these are the definitions simply. So if you look to this, here there is response. This is again response, mental and physical. Circumstances, there is again environment. They are nearly similar definition. Stress, generally we have eustress and distress. Eustress, anything that may be good stress or not so distressing, not so annoying you or disturbing you. Like if you have trouble dating, meeting, visiting other, they are scientifically regarded as a stress. Why? Because you should respond to circumstances. But they are good stress, causing not too much annoyance or distress or discomfort. Well, when we talk about the stress, we are talking about the distress or the bad stress, the stress that causing annoyance, causing discomfort, causing displeasure, mood, or they name distress. So whenever we say stress, we are meaning the distress, by the way. يعني stress عادي يعني by definition anything is stress now. Attending the lecture is stress, listening to lecture is stress, because you should respond to circumstances. So anything is stress in the world. But when we mean the stress, we mean by distress, the negative, the bad, the annoyance, the distressing. Stress composed of two parts. Look from here. Is there should be a stressor, condition or event from the outside. And in stress, there should be something, event, condition outside. And your reaction or response, which is mentally or physically. Mentally, again, we say thinking, emotion, behavior, and physiological change. So stressor from the outside, and we have the stress reaction, your reaction, two parts. So stress is not just one part, it's two parts. There is an event and your response, not just response, the event itself also. So this is in this slide, very simply, stress is our response to circumstances, our mental, physical, response to adapt to environment. It composed of two parts: stress reaction or response, and which are also either mental or physical, and stressor, which is the source or the event or the circumstances. In psychology and psychiatry, stress regarded as like a pathogens. Like in medicine, you have pathogens, microbes, you have the bacteria, viral, parasite, fungi. In psychiatry, stress, as if it is something will enter your body, you will face. So it is like a pathogen. So how you will adapt to that stress, it is your immunity, whether this pathogen will cause a disease or not. It depends on your response. So there is a stress pathogen and your immunity is your response. Stress and emotional mediated response act as pathogen, but not necessarily always cause disease, by the way. So this is pathogen stress. If my immunity is good toward the micropathogen, so I will not develop any symptom. So if there is stress, if my coping adjustment, adaptation is good, it will not affect me. So there is stress, there will be some physiological change and response, mental response and physiological change. And this will demand your response, will demand you will too much be affected by the stress or disease or not. So what is stress? Let us, it was at the definition, let us study the stress from other points. Stress from the inside means physiologically, what happened inside the body. So we'll study the stress from the inside. We'll study the stress from the outside. What are the environmental factors that causing stress or distress, or the common stressor in the environment? And we will study the stress as a process. So it will come how you will respond to that stress. It is a process. How you respond. That is your cognition mainly, and the theory is named transactional model of stress. So from the inside, what is stress? Theories regarding the stress. What does the stress from the inside mean? What is happening inside the body? So stress from the inside, physiological response. Cannon, 1932, Cannon, he tried to study the effect of the stress on the body, especially the acute or recent or at the beginning of the stress. Whenever there is a stress, again, we mean the distress, the body will try to adapt, to adjust. Either the body will make you to fight the stress, to face the stress, or fight the stress, or run away, flight from the stress. You have an exam, it is a distress, so either you will study well, put a schedule, study well, or you will leave everything, This is, whenever we see a scared animal or insect, either we'll try to kill, to face, to fight, or run away from that. So this is the first response. Tomorrow's stress is exam, so this is the recent stress. You will see an insect or maybe snake, so this is a stressful environmental event. So either you will fight, try to kill, or run away. What happened? This theory is named fight or flight theory by the Cannon. This is the Cannon who studied the effect, recent or acute effect of the stress on the body. He said it is a short-term change to mobilize for activity. There will be some changes in the body to mobilize for it, to make you to be active, either to try to fight, to face the problem, or run away. And triggered by catecholamines release, adrenaline and noradrenaline. So this theory is named fight or flight by Cannon. It is for the recent or acute or the beginning. First moment when you face any stress, what will happen to the body? So let us study more in more details. So the theory also named adrenomedullary response, or SAM, sympathetic adrenal medulla complex. What is this? Here, whenever we see or face a stress, for example, as we said, insect or animal or earthquake, for example, or suddenly I will say, this is a quiz. So here, any or new news, bad news. So here the hypothalamus, the amygdala will innervate the hypothalamus in the brain. Hypothalamus will be activated through the amygdala, which is the part of the brain which is responsible for the fear and anxiety. So it will activate a hypothalamus. Hypothalamus will innervate the sympathetic nervous system. This is the sympathetic nervous this chain. Sympathetic nervous system again will innervate the adrenal gland, suprarenal gland, adrenal gland. This is the adrenal gland, and especially the medulla. The medulla of the adrenal will be innervated by the sympathetic, which will release catecholamines, adrenaline and noradrenaline. And adrenaline, noradrenaline will circulate through the blood to innervate internal organ to prepare you for fight or flight. So pupil will be dilated. You want to see more. Salivation will be weak. No need for salivation. No need for the stomach ingestion will be inhibited. The respiratory will be more shortness of breath or rapid respiration. You need oxygen. Heart rate will be fastened or accelerated. You need more blood to be circulated. Liver will change the stimulate glucose release, glucogenolysis, more glucose that's stored, and so on. So many physical changes will happen, physiological changes in the body to prepare you for the fight or flight. This is again hypothalamus sympathetic. So this from the name adrenomedulla. So the medulla of the adrenal. This is the name adrenomedulla response, because the medulla of the adrenal gland will release the catecholamines, adrenaline and noradrenaline, and adrenaline from the name, or the sympathetic adrenal medulla. Look, the name from complex, SAM, sympathetic, because sympathetic nerve innervate the adrenal medulla to release adrenaline and noradrenaline. This is the adrenomedulla response, or the SAM, sympathetic adrenomedulla response. This is for the acute response to the stress. First few moments to the minutes, hours, maybe days, you may live under this effect. So again, hypothalamus, sympathetic nervous system innervation, and adrenal medulla will release adrenaline or adrenaline, which will circulate in the blood and causing some physiological change. Why this physiological change? To prepare you to adapt to the situation, either face or run away, fight or flight. So again, activation of sympathetic adrenal medulla, perception of stress, because hypothalamus via nerve connection to activate sympathetic nerve fibers. Sympathetic fibers will activate adrenal medulla. Adrenal medulla will secrete the catecholamines, epinephrine, norepinephrine, or adrenaline and noradrenaline. Adrenaline, noradrenaline increase heart rate, blood pressure, breathing rate, blood glucose level will be raised. Shut down digestion, no need for digestion now. And this is a rapid, very rapid, short-lived response to stress. Usually this is not prolonged. Sympathetic adrenal medulla complex. This is the first. This is the recent, acute, short, at the beginning. And Cannon studied this response, physiological response in details. What if the stress prolonged, become more, what will happen? يعني stress كهرما. A female badly treated by the husband, for example, or one of your colleagues not talking with you, or badly treating your colleague, or bad socioeconomic state prolonged, or exam, the period of the exam too much prolonged for whatever the stress problem in the relationship with the other, so you know, disease, uncontrolled diabetes. So here the stress prolonged, not short, matter of weeks or months, prolonged. What will happen? So there's what will happen? What are the physiological changes that will occur in the body? Here, other part, again, hypothalamus will involve in the process after prolonged, but in another way. It will stimulate the pituitary gland at this time. Pituitary gland will stimulate, will innervate, or will not innervate, so stimulate the adrenal cortex here to release hormone. Here, the role of the hormone will be involved in the process. So this process for prolonged stress is named, it's the not sympathetic, not nervous response. This is endocrine response. So endocrine system will be involved if the stress prolonged. Hypothalamus, pituitary adrenal cortex, HPA cortex. So hypothalamus will release the hormone adrenocorticotropin, a corticotropin releasing hormone, which will stimulate the pituitary gland to release adrenocorticotropic hormone. Adrenocorticotropic hormone will stimulate the adrenal gland, the cortex here, to release the cortisol. So cortex, cortisol, for simplicity. Adrenal cortex, cortisol will be released. So this pathway is named hypothalamus pituitary adrenal cortex, usually in response to the chronic stress, prolonged stress for the long period, not at the beginning. Hormone not involved, just the sympathetic nervous system or the nervous system involved at the beginning of the stress. So again, or it is named adrenocortical response, the cortex. So occurs through the activation of the hypothalamus pituitary adrenal cortex complex, HPA. Perception stress causes the hypothalamus to release adrenocorticotropin releasing hormone, or sometimes named corticotropin releasing hormone. This causes anterior pituitary gland to secrete adrenocorticotropic hormone, which will stimulate the adrenal cortex to secrete the cortisol. We have two types of the cortisol, either the glucocorticoids and mineralocorticoids. From the name, glucocorticoids will try to raise the concentration of the glucose in the body. So protein and fat will be metabolized into glucose. You need more glucose to face the stress, reduce inflammation, suppress immune cells. The glucocorticoid. Mineralocorticoids, from the name minerals, act on the minerals and the blood volume. Blood volume pressure increased to avoid the hypotension. So this process, hypothalamus pituitary adrenal cortex, usually it is slowly developed, but longer lasting response to the chronic or prolonged stress. So, and the bad effect, cortisol, by the way, in the beginning is good to prepare your body to face the stress again through the glucocorticoid or mineralocorticoid, two types of the cortisol, the effect on the glucose level and the mineral and the blood volume to prepare you. But too much amount of the cortisol for the longer period, this is the bad effect of the stress. This is the bad effect. So cortisol is good, but if again within a normal or appropriate level, yani concentration, or for again appropriate duration or period. So level is low, duration is low, cortisol is very good to prepare your body. But too much cortisol for a long time, this is the bad effect of the cortisol on the health. And you know the effect of the cortisol for it we will start in the brain. This is we are talking about if a high amount for prolonged period. It means too much cortisol. For it affects the mental state, the anxiety, depression, even neurological headache, memory will be affected, attention, sleep, decrease the serotonin, mean depression more and anxiety more. So affect the brain, the central nervous system. It affects the heart, it causes heart disease, it affects the bone, bone formation. Blood sugar will be high through the liver, glucose, and the pancreas. It will increase sodium water retention, too much retention, hypertension again. Digestive system will be affected, GIT, even problem in the intestine, immune system will be affected, suppressed, muscle will be decreased, amino acid uptake will be decreased, even the infertility and even adipose tissue after a period will be breakdown of fat and thinness. In addition to nerves themselves, it will cause decreased sensation of the pain. So look to the bad effect of the cortisol, too much for longer period. Again, not a short period and little amount. Too much cortisol, it affects whole organ of the body, and this is the bad effect of the stress. So we talk about this again, the seminar, if you want to in more details, the effect of the stress on the body. So we have sympathetic adrenal medullary response acute to the stress. It is hypothalamus sympathetic adrenal medulla, adrenaline noradrenaline. We have the hypothalamus pituitary adrenal complex, which is the hormonal release. So long-term stress response is damaging. Seeley, again, this was Nucano. Seeley tried to study the long-term or response to stress, and he put a theory. He classified the stage of the body in response to the theory, and he can stages. He named the theory general adaptation syndrome. So what will happen in the body after response to the stress? He studied this process in another way. يعني أول ما قلت عند بيجني adrenomedular response which is sympathetic adrenomedular complex and she had adrenal cortex adrenocortical response and should be hypothalamus pituitary adrenal complex acute stress. Seeley tried to study the body response to the stress in another way. بطريقة كوديفان, we could name this theory the general adaptation, يعني how you will adapt generally to the stress. Seeley, it's important the name. Seeley's theory about the stress, being general adaptation syndrome. Long-term exposure to stress lead to illness, as we say. The effect of the cortisol, too much cortisol, mainly due to the effect of the cortisol. It's cortisol by its name, the stress hormone. Stress hormone, the cortisol. Again, cortisol and the chronic, nel beginning, adrenocorticotropin releasing hormone from the hypothalamus, pituitary gland, adrenocorticotropic hormone, and adrenal gland, the cortex of the adrenal cortisol. So it has two main effects. Well, this is cortisol is C21. H30O5. This is the chemical. By the way, just this for information. Don't afraid it will not ask you in the exam what is the chemical component of the cortisol. So what is general adaptation syndrome? Hans Seeley guessed general adaptation syndrome. He's tried to study the body response to the stress in another way. He classify or divide the stage of the response or phases to three phases. He named the first phase of our body response to the stress, phase of the alarm. Phase 1, alarm. Alarm here means mostly it is again the sympathetic. It is the sympathetic adrenomedular complex. Yani sympathetic nervous hypothalamus, sympathetic, adrenal medulla, adrenaline, and noradrenaline. So it will alarm you, prepare you to fight or flight, to fight mainly. So this is the first phase, phase 1. Phase 1. If the stress prolonged, here the involvement of the second process or hormonal endocrine will start gradually. It is then he named this phase of resistance. You will try to cope better, try to do your best. So the body resistant to stress can only last long before exhaustion. So you will try to, your body, your mentally, physically, whole body will try to face the stress he named, and it is the beginning of the hypothalamus pituitary adrenal complex or the endocrine involvement of the process and the cortisol, and you will try to control the stress. If the stress control, so this is the phase 2 resistance. So at the beginning, it's alarm phase, resistant phase. If the stress prolonged, too much cortisol, and for prolonged period, and you are unable to control the stress is continued, whatever the stress, so you will enter the phase of the exhaustion. Exhaustion, the body will be exhausted, severe depleted, and the internal organ will be depleted and will be exhausted, and the phase of the diseases. He named the exhaustion phase. So according to the Hans Seeley, we enter the three phases when we face a chronic stress or any stress. At the beginning, phase 1, alarm. Other there is alarm, which is the sympathetic nervous system activation to adapt you. If the stress is prolonged, you will enter the stage of the resistance. Your body will try to resist that stress. Here, the endocrine system will be involved through the cortisol. And if the stress prolonged, and still you are unable to control the stress, here, too much cortisol for the prolonged period, you will enter the stage of the exhaustion, which is the stage of the diseases. Stage of the disease. This is the general adaptation syndrome by Hans Seeley. So this is the summary the two response. Here the stress is short term to hypothalamus through the nerve will activate the sympathetic nerve, sympathetic adrenal medulla. Adrenal medulla will release the epinephrine and norepinephrine. And prolonged stress, here hypothalamus through the hormone will activate the pituitary will activate the adrenal cortex, will release the glucocorticoid and mineralocorticoids. Okay. Stress as a response is very valuable. It understands how and why stress may have a direct impact in the health. It's very clear, so it's value. But the problem here in this theory is no psychological aspect, yani your cognition and your assume non-specific response to all stressors. They have the similar all stress I have a similar response. So these are not clearly defined, all these. Its effects all seen as outcome after exposure to stressor. Yani all these result after the outcome. What happens if the opposite, some changes in the body and how the body will respond to that stress. So this is simply it is a very good theories to explain how and why stress affect the body, but still, especially the psychological aspect is not very clear in the process. This all was the stress from the inside, Our body responds to the stress group, whether the canal or the Hanseli, how they express, whether the acute and the chronic. Now the second part from what is stress? It's stress from the outside. What are the stressors from the outside, environmental circumstances? So stress life events, Holmes and Ray, in 1967, they put a scale. How many stressors we have and the effect of each. They try to study in details. And the daily hustles and athletes can try to study this. So let us, what are the stressful life events by Holmes and Ray? Look, Holmes and Ray life stress inventory in the division, and the social readjustment rating scale vision. They try to study the stressor, how many stressors we have, and the effect of each. And they give them numbers. They put the death of the spouse, of course, if there is a good relationship. Death of the spouse is the most stressful life event. Give it number hundreds. And below is the death of relatives or family members. مثلا parents or brother or sister نزيكي وين. So divorce they give it 73 يعني degree degree بتاعي. So the most stressful life event. And look, past marital separation 65. Look to the marriage they give it 50. So despite the marriage is maybe good, or it may be causing a pleasure or hobbies for the all, or it's a natural occurring life event, but it's stressful again because you will change your life for both boy and girl, for both. So the life will be changed. You'll expect too much responsibility. So it is stressful again. Look, and death of close friend, for example, give 37. So this is the Holmes Ray life stress. The most stressful life event is the death of the spouse if there is a good relationship, and throw on. Even the pregnancy, look here, the pregnancy, it is 40. It's a stressful event, by the way. Pregnancy itself without complication. If there is a complication, you will add the numbers. Look, and you will pass through all these. Trouble with the boss, for example, 23. If you are officer, you have a boss, someone responsible for you, trouble. Now, for example, even you can regard trouble with lecturer, you're a teacher, with the dean. Even look, major change in living condition, 25, changing the place. Till even the vacation, they are 13. Vacation, by the way, it's also stressful event. Numbers, what you will do, how you will arrange, how you will. You will sleep, you will study, you will relax, you will travel, you will use all these, even the major holidays. Minor violation of the laws, traffic, for example, traffic tickets light 11 وقت النجاة مثلا برتقال يا الصورة you pass. It's a minor violation. You are not sure it was 100% YOLO. So this minor violation, this also stressful event. So this was the scale by the Holmes and Ray. What they said, if your point in the last year, 150 or less, last year, low amount of life changes and low susceptibility to induce health breakdown. So you are less likely to develop health problems secondary to stress in the next 2 years. If it is 150 to 300 in the last year, you develop these numbers. So about 50% chance of major health problem in the next 2 years. major health problem. If more than 300 points or more in the last year, according to this scale, so 80% you will have a major health problem in the next 2 years. Of course, if you are unable to control, يعني كتشنكي أما stress ability to تشنكي like any other normal person, you didn't يعني أما how to chew and causing these numbers more than 50, you are highly susceptible to develop. Okay, so another classification of the stressor is the types of the stressor. This is the classification another way. Stressor can cause anything that causes stress between stressor, that sort. They classify it in another way, and so you get almost unready in another way. 5 general categories maintain. Actually, biological, by the way, the common stressor is the biology illness. Diabetes, hypertension, cardiac, renal failure, stroke, they are the common injuries. Environmental stressor, outside, poverty, noise, pollution, these are environmental. Life situation stressor are accidental. Sudden death, divorce, family problems, love affairs nowadays, too much situation with the best friend and so on, and the relatives, problem with the relatives. So biological, environmental, life situation, we have cognitive stressor and personal stressor. So if you look, why we separated too much these two? If I ask you why they are separated slightly, cognitive and personal. I think most of you will know, because you can control these two. Cognition, it's your cognition, how you handle the situation. I can't, it is difficult, never, there is no choice, pessimistic, helpless, hopeless, I am failure, I am. So these are cognitive stressor, your thought causing stressor to you, by the way. It's the cognitive, it is under your control, because biology and environmental life situation, sometimes you can't control, it's outside your control, but your cognitive, at least cognitive stressor, you can control them. Personal behavior, I guess, stressor, negative reaction. Too much using smoking and tobacco, too much alcohol, drug abuse, no exercise at all, poor sleep, all these, they are stressor again on the body. Why separated to, again, cognitive, personal? Because you can control at least these two categories of the stressor, which they are, again, common source of stressor, common source. So these are the categories of the stressor. In another of course, value, useful way to measure stress, this is to measure stress, are related to illness, evidence value, but problem here in this, from the outside, not every particular event has the same effect to the all. There is individual differences, self-report issue, everyone report different kind of stressor. What's the effect of the, if it is short or long with the, so it is again valuable, but still we have some problem regarding the studying the stress from the outside. From the outside, stress as a process, we will discuss it after rest for 5 minutes. So take your rest for 5 minutes and rejoin, please. Okay. Now goodbye and rejoin after 5 minutes.